So we're going to talk about products you're not used to talking about when it comes to respiratory wellness, and we're going to talk about some other things too. So it's about our whole wellness, our sleep, how we recover, how we rest, how we take care of our mind. So wellness is a very complex puzzle, and it doesn't need to be. We've got some really amazing products in our in our dōTERRA tool belt. And so today we're going to talk about some ones that you're probably not used to. So we're going to buckle in. If you've got any questions, I will get to the chat towards the end. But Dr. Riggs, I would love to hand over to you, please.
Perfect. Thank you. It's so good to be with you guys and see familiar faces. I love being with my friends around the world, and you guys I consider my friends. Jackie, as always, pleasure to see you, and many others. So this is fun to be with you guys tonight. I'm excited to talk about this subject. Respiratory wellness is so very important. Why don't you go to the next slide for me, Simone, if you would? Um, Today I want to talk about how we maybe expand our thinking on respiratory wellness. Most people think about lungs in isolation, like airways, sinuses, seasonal discomforts. But from a physiologic standpoint, breathing isn't just lungs, right? There's so much more. Your respiratory experience is shaped by your immune system, your nervous system, inflammatory balance, metabolic function, even your sleep quality affects your respiratory function. And underneath all of that is our foundational wellness, right? Having that solid foundation for our health of cells, tissues, organs, systems, and then, of course, you as a person. Let's go to our next slide. So at dōTERRA, we believe that optimal health starts within. By prioritizing that foundational level of nutrition and digestion, you actually lay the groundwork for a vibrant and thriving life. The core of our wellness philosophy at dōTERRA is, of course, the wellness pyramid. We anchor to that very strongly because really it takes care of all of the issues. There's not a single issue that I see within my practice that I can't go back to a portion of the wellness pyramid for what is the underlying problem there. It's a great roadmap for holistic well-being, with nutrition and digestion, of course, forming that foundational level. And our next slide, if you would, Simone. Because the reality is the body can only perform as well as it's nourished. That's just the fact there. So that's where a lifelong vitality pack becomes essential. I will tell you in my practice, as I see individuals and they come in with this problem, I know that if they're not addressing foundational health with something like Lifelong Vitality Pack, whatever I do to address that problem is not going to be nearly as strong, right? So LLV provides daily nutritional support to help fill some of those common nutrient gaps. It supports cellular function and really supports overall system balance, something I would consider called homeostasis. And when the body has the foundation in place, it's better equipped to respond to seasonal stressors, maintain balance, and support overall respiratory wellness. So before we talk about targeted tools, we have to acknowledge that consistency in foundational wellness is what makes everything else more effective. And from there, we can begin to layer in more specific support. Now, again, just a reminder, if the foundation is strong, usually that takes care of a lot of the problems that you would build on top of that foundation. So if you're dealing with someone that says, I am concerned about these particular issues, tonight we're talking about respiratory health. If they're not building on that foundation, start there. Help them understand what we do here is going to help us with whatever else we do on top of that. So it's so relevant to that conversation. All right, next slide. The respiratory system is one of the body's primary points of interaction with the external environment. Think about that. Whatever environment that we are in, we're taking that environment in deep into our system, and it is affecting us. Every breath we take takes in not just oxygen, but also whatever is floating out in that environment as well. So the body relies on several key protective and regulatory systems. Barrier systems like the mucosal lining of the lungs, immune readiness to respond to seasonal challenges, nervous system regulation, which influences breathing patterns. You all know as we get nervous, we get in a heightened fight or flight, that breathing becomes rapid and shallow. Not great for us, right? Balanced internal response, which then affects comfort, and then cellular energy, which determines how efficiently we begin to use our oxygen that is brought in by the respiratory system. So when these systems are supported, breathing tends to feel easier. When they're not, the body, frankly, has to work much harder. So our goal is to not force the system, but it's to support the system that then supports breathing. I love that about doTERRA. We're not here to push the body to do something it wouldn't ordinarily do. We're here to say, how do we support the body to do the job that it was made to do and make sure that it's doing that efficiently? So I really love that. All right. So we're going to start with, go ahead to our next slide there. We're going to start with supporting the body's natural defenses. How do we strengthen our natural defenses? So the next slide, let's talk about oregano touch for a moment. Oregano is one of the most chemically robust essential oils we have. It has carvacrol and it has thymol in it. Those two chemical components make oregano so incredibly powerful. It's known for its ability to help the body maintain a healthy environment during times of seasonal stress. In a topical format, like Oregano Touch, it offers a more approachable way to use this powerful oil, supporting the body's natural defenses in a gentle, targeted way. So I love Oregano Touch because oregano, the bottle itself, does require some teaching. We've probably all heard of people's experiences with straight oregano. They put it on, they do something with it, and then they're like, oh my gosh, that was horrible. Like, yeah, but oregano touch, you can hand that to anybody. They use it. There's no education involved with it at all. They won't have a problem with using oregano touch. The next one is, go ahead, Simone, Stronger Touch. This is an amazing blend from our kids line, which I really love. Stronger is cedarwood, litsea, frankincense, rose, and I love that it is already diluted in fractionated coconut oil because now I can have my kids go and grab it. They know what each of the kids' blends are for, and they can grab it, and I can feel comfortable with that. So Stronger Touch is a blend designed to support resilience. It combines those oils that help maintain a clean and supportive environment, supports the body's natural defenses, provides an added layer of support during seasonal shifts. This is all about reinforcing the body's ability to adapt, not by pushing harder, but again, by supporting balance. And I love that about our stronger blend. It's amazing. All right, so next slide, we move from supporting the body's natural defenses to promoting really clear and open airways or clear and open breathing. I love that, Jess. Boys use this blend, so it's a great one. So let's talk about Supermint for a minute. Supermint, the hero chemistry in the blend of Supermint is menthol. Menthol interacts strongly with a pathway called the TRPM8 pathway. Now I'm pretty nerdy. I love that stuff. So for me, that's really powerful knowing, thank you, um, knowing the pathways by which these oils work. Um, so again, menthol, calcium channels, that's how it works. Supermint is a blend that creates a strong sensory experience with airflow because of the pathway that it works. The combination of mint oils and that menthol contributes to that feeling of openness, clarity, refreshment. So this sensory input can influence how we perceive breathing, making it feel deeper and more satisfying. So when someone says, boy, I just feel like, oh, I'm having issues here, I love Supermint because it contributes to, oh, I feel much more open. I feel much more calm. I feel like my breathing is easier here. And that's, again, all about menthol and that TRPM8 pathway. It's a calcium channel. So TRPM8 is the name of that calcium channel. Okay, next slide. Spanish sage is our next one. This has 1,8 cineol in it. That's one of the hero chemical components of Spanish sage is 1,8 cineol. 1,8 cineol, if you remember, is also found in eucalyptus and cardamom. It also has a few other chemicals in it that support respiratory systems like camphor and alpha and beta pinene, as well as camphene. Now, Spanish sage supports a sense of mental clarity, a refreshed environment, and then a feeling of openness in breathing because of that 1,8 cineol. This can be especially helpful during times of fatigue when both mental clarity and breathing awareness feels diminished. That's your Spanish sage. It's helpful. When you think Spanish sage, think brain, lungs. Those two systems are affected by Spanish sage. It's amazing. Okay, next slide. So we're moving from promoting clear and open breathing to sleep and recovery. Sleep is so important when it comes to our respiratory system, and we don't often think about it that way. We think sleep for other things, but sleep actually is important for our respiratory system, and we'll talk about that. So, next slide. I love this oil. Now, I was raised in Arizona, and Arizona, when it rains, it smells like dirt. If you've ever smelled the desert during a rainstorm, it is home to me. And vetiver, to me, smells like home. Now, vetiver supports respiratory resilience because respiratory resilience is built during recovery. Vetiver is largely made up of sesquiterpenes like alpha and beta vetivine. And because of those sesquiterpenes, it is very grounding as an oil. This is one of the few oils that when you drop it into water, it goes to the bottom. It's so heavy in sesquiterpenes, it doesn't float on the top like most other oils do. It goes directly to the bottom. But because of those sesquiterpenes, it supports calmness, stillness, a settled state. It's a great product for evening routines, helping the body transition into rest. And so it is a fantastic oil. The way I like to use vetiver is I use it all the time when I travel. I'm in various time zones all the time, but I like to take vetiver out and put it on the bottom of my big toe. In traditional Chinese medicine, that's where the pineal gland of the brain is kept. And the pineal gland is what controls our sleep-wake cycle. So putting vetiver on the bottom of my big toe in the evening of whatever time zone I'm in helps my body regulate into that time zone. And so that's how I use vetiver. Now, I often joke that vetiver is great for sleep because sometimes you fall asleep while you're waiting for it to come out of the bottle. It's a very thick oil. It does take some time. One of the tricks I've learned over time is if I can take that bottle and hold it in my hand while I'm doing other activities, just the heat of my hand will warm the oil up enough that it comes out a little faster with that way. So, all right, next oil. The next oil is valerian. Okay, so valerian is also a heavy sesquiterpene oil. Now remember, when we think sesquiterpene, think grounding. So vetiver is another grounding oil. Valerian has um, valerianine in it. I love it when you name it for the oil that it's in. That always makes it easier. Like, what chemical compounds in valerian? Well, valerianine is in it. And then also beta-caryophyllene. So remember, like our copaiba has beta-caryophyllene in it as well. It supports restful sleep and relaxation. So sleep is when the body rebalances those internal processes. You have to sleep if you need your system to be in balance. It supports immune function. It restores and resets. The other thing that happens when you sleep is your neurons in your brain have a rinse cycle that they go through. They get rid of all of the things that have built up during the day and wash those out in your cerebral spinal fluid. And then the next day they're reset. So sleep is so important to make sure that we're functioning properly. So when sleep improves, the body is better equipped to handle daily stressors, including those stressors that influence respiratory support. So now we're going to move from sleep and recovery to nervous system regulation and breathing, promoting a calm environment, making sure that our system and our brain are relaxed and calm. So, next slide, we're going to talk about simplicity. Now, I love the way that you guys have named this oil. In the US, we've named it HYGGE. No one knows how to say that. I'll just be honest. We don't. Nobody knows. We look at it and we're like, is it Higa, Higa? What is it? It's actually pronounced Huga. Uh, Simplicity is a lot easier. It's fantastic. Okay, so one of the most overlooked influences on breathing is the nervous system. So when the body is under stress, as we talked about earlier, breathing becomes very shallow. Muscles around our chest tighten and the body shifts into a much more stressed and guarded state. So, simplicity supports emotional grounding, a sense of calmness, and a more relaxed internal state. And when the body feels more regulated, breathing naturally becomes more efficient. Deeper breathing, slower breathing, the breathing that helps us get oxygen into the system and get rid of toxins through that exhale. And so I love simplicity for that benefit. Next slide. Next slide is Northern Escape. Now, Northern Escape is a tree blend. If you guys know me, you know I'm a child of the mountains. I love mountains. I love forests. This is where I feel at home. So, Northern Escape, being a tree blend, has in it black spruce, Siberian fir, cedar, cypress, and hinoki. And those oils bring you back to the forest. It helps create a sense of emotional reset, environmental freshness, mental clarity, and reducing overall stress loads plays a meaningful role in how the body regulates those breathing patterns again. You can use these in times of quiet meditation to ground you into the natural world. One of my favorite ways to use Northern Escape is when I'm meditating in my home and I can't make it out to the forest. Northern Escape is a great blend to use during meditation because it brings the chemistry of the outdoors in. And when we're in nature, our system tends to calm much, much faster. Okay, next slide. Now let's talk about internal balance and physical comfort, because when we don't have balance or when we don't have comfort, again, breathing and respiratory systems are affected. So the next product that we'll talk about is Copaiba, or I just got back from Brazil on Sunday, and you better not pronounce it Copaiba there. It is Copaiba. I'm very adamant about that. So we'll just say we're all Brazilian tonight. Copaiba soft gels, so important. Copaiba soft gel supports the internal regulatory system. And I love what you guys can share about Copaiba. I would encourage you, anytime you talk about it, go back and refresh the things that you can talk about it, because you all are blessed to say things that no other market that I'm in can say. I am very jealous when I'm in Europe, even Brazil, where this comes from. I feel a bit handcuffed, to be honest with you. So let's review those things. Copaiba soft gels, about 135 milligrams of Copaiba in your soft gels, traditionally used in Western herbal medicine to relieve the symptoms of medically diagnosed cystitis. It relieves the burning sensation or irritation with urination associated with that medically diagnosed cystitis. It maintains urinary tract health, clears respiratory tract mucus. So your mucus is cleared using this. It reduces and relieves bronchial mucus congestion. Also supports general health and well-being by interact with the endocannabinoid system. It's traditionally used in South American medicine, again, Brazil, where this comes from, the Amazon jungles, to relieve inflammation, to relieve mild joint aches and pains. And so it's often used to support a healthy internal balance, physical comfort for the body, and an adaptation to daily stressors. So again, a reminder, when the body's in balance, it tends to experience greater ease across multiple systems, including the respiratory system. Okay, next slide. So this is all about maintaining energy and metabolic support, right? Breathing is only part of the equation. What the body does with the oxygen that we put in the system matters just as much. And so what we know about MetaPower Assist is it helps support healthy blood sugar and glucose levels, reduces carbohydrate metabolism, great. For those of us that are carboholics, I know there's many of us, we probably ought to form a group. This is a great product, right? Because it helps us reduce that carbohydrate metabolism. MetaPower Assist supports metabolic function, cellular energy. Again, what we do with the oxygen we breathe in is all about MetaPower Assist. Consistency in daily rhythms. And when energy production is supported, fatigue is reduced, resilience improves, and the body functions more efficiently overall. So it is a great product to be using to support respiratory health. All right, next slide. So let's talk integration in this. When we step back and look at this from a systems perspective, we see that respiratory wellness is not driven by just one pathway. As it turns out, everything is connected, right? We've got this great network inside the body. It's influenced by how well the body defends itself, how clearly we experience breathing, right? Think about, okay, I don't feel like I'm breathing well. What happens to my brain? I get a feeling of anxiousness. When I get a feeling of anxiousness, it affects my respiratory system and I breathe rapidly and shallowly. So how clearly we experience breathing is important, how well the body recovers, how we regulate the nervous system, and how efficiently energy is produced. Each of these products supports at least one of those areas, and a few of them, 2 areas at a time. So together, they offer a way to support the body more holistically. Without needing to rely on a single approach, you have multiple approaches for supporting the respiratory system. Okay, so next slide. Let's talk just briefly about what we might consider a daily routine with these products to be when considering daily support. Of course, in the morning, we start with our foundation, our lifelong vitality pack. That is where we begin really any discussion in doTERRA. So daily nutritional foundation. Then we might consider aromatically diffusing supermint or Spanish sage to promote a sense of clear and open breathing and mental clarity. And then our oregano touch or stronger touch, depending on what we want to reach for, to support seasonal resilience. That's our morning routine. Let's go to our afternoon routine. Our afternoon or midday routine would consist of our MetaPower Assist with our meal at lunch to support energy, metabolism, and daily consistency. Also, by the way, taking our MetaPower Assist with lunch helps us prevent that afternoon slump about 2 p.m. where we go, oh my gosh, I still have many things to do today, but I'm just not feeling the energy. Taking our MetaPower Assist with lunch will help with that. And then our Copaiba soft gel to support overall internal balance and physical comfort. 1 to 2 Copaiba soft gels. taken internally then. And then evening, let's switch to our evening routine. And I love this one. Evening is all about winding down. Sometimes we think about we're busy, busy, busy. When the sun goes down, we turn on overhead lights. We want to make it daytime in our homes. And then we keep going, 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 going until it's our bedtime at 10 or 10:30. And all of a sudden we go from complete daylight to night by turning the lights off with no wind down time in between. We need to reinstitute evening in our lives. Our bodies are wired for a wind down period of an hour or two where we have lower light in our homes. We're doing calming activities. And so, as a part of that evening reset, we can reach for simplicity or northern escape to create that calm and grounded environment to help the body begin to unwind. Now, consistently using that helps the body also trigger when I smell this, I know we're going into an unwind time, a calm time. And so making sure we do that on a daily routine. And then, of course, before we go to bed, either using vetiver or valerian for those sesquiterpenes that help the body even more to support relaxation and restful sleep. Again, you can diffuse those or put them on topically somewhere on your body or put them on the bottom of your big toe to help signal the brain it is time to calm down and go to sleep. So you don't need everything every day, but you should be considering what is my routine to support my respiratory system. So think in simple choices, not checklists. Morning, clarity and support. Midday, energy and balance. Evening, calm and recovery. Those are the 3 times of day that we should be focusing on for respiratory wellness. Again, you don't need to do everything every day. Just choose what fits your needs and stay consistent with those basics. Make sure you're doing those things on a consistent basis. Okay, next slide. Now, respiratory wellness is not just about the lungs. It's about how the body functions as a whole. Think about this. If your respiratory system isn't doing well, how's the rest of the body doing? Not well. Turns out it's rather vital, right? Turns out breathing, rather important. And so when the systems that support breathing are balanced, the experience of breathing tends to improve naturally. So instead of chasing outcomes, we support the processes. And when the processes are supported, the body does what it's designed to do. And I love that. At dōTERRA, we're not pushing the body to do something it wouldn't naturally do already. We're saying, how do we encourage and support the system to do what it was naturally designed to do? That's where true resilience lives, is in that approach to health and wellness. Our bodies are perfectly created. It is the only machine in the universe that is made to fix itself. And if we can give it the right environment to do its amazing job perfectly, we experience the benefits of health throughout our lives. So I love that. I'm grateful to have joined you tonight for that conference or that convention or conversation around respiratory wellness and how important that is for us to make sure that we're doing those things to support it. So thanks.
We love hearing about how we can support the body as a whole system when rather than addressing just a single need. I have a question because we've finished a little early.
Sure.
So,
Yeah.
Jackie and I have this conversation quite a lot where we think people just really don't appreciate the power of Metapower Assist, right?
Yeah. Agreed.
And I'm a type 1 diabetic. I wear a monitor, so I get to see the benefits of taking that product. And
Yeah.
someone actually challenged me in a meeting yesterday and said, metabolic resilience isn't important. So I would love to ask you that question. Yes, that was exactly my response. I was like, I think I need to leave this conversation. I would love us to just say out loud why metabolic resilience is so important to your overall health.
Okay, so let's talk about what metabolic health is. Metabolic health is making sure we have an appropriate response to blood sugar, that we have a healthy level of cholesterol in the body, that we are maintaining a healthy weight and that we're maintaining a healthy energy production, because all of those things are related together. Now, too many times we look at metabolic health measured by a scale. And I need you to remember something right now, particularly you amazing ladies. A scale only tells you your relationship to gravity. That's it. It does not say how amazing you are, what gifts you have, what an amazing individual you are, how you love others, what your experience in life is. It tells you nothing about that. It says, this is my relationship to gravity. So don't get too hung up on that's my marker of metabolic health. It is a marker of metabolic health. There are so many other things. What we find in the world today, and I will say, let me just say, this is probably our fault in the US. As I travel the world, I can tell you what the metabolic problems are of any country I go to based upon how many US restaurants, fast food restaurants I see between the airport and the hotel. If I see McDonald's, Kentucky Fried Chicken, Wendy's, etc., Pizza Hut, all of those things between the airport and the hotel, I know exactly what metabolic problems you have. We in the US lead the world in metabolic health issues, right? And so, where our diet goes, our problems go. And we have to address metabolic health, because if we
Mm-hmm.
don't, the statistics are already alarming. 1 in 3 children born today will be diabetic in their lifetime, right? And so, understanding we have got to change lifestyles from the beginning of kids' lives so that they don't have the outcomes that many of us have gotten to is is of utmost importance. If we don't change the trajectory, I don't know how many of you have all seen the movie Wall-E, a lot
Oh
about a
my
little
gosh, yes,
robot
the
on
chairs,
Earth,
the
right?
people in the chairs.
Yes, that's exactly where we're headed. We're headed
Mm.
towards, I can just go get my nutrition through a cup. I don't have to move. The TV is right in front of me, and I can just scoot around all around, my environment, sitting in a chair and don't have to move a muscle. That's where we're headed. Unless we do something about our metabolic health and we take it seriously. And so it is probably one of the most important things to address in the world today. And MetaPower Assist is an amazing product to help us with that particular issue. So,
Yeah, I have
yeah,
to say it was Jackie that convinced me because yes, I'm a type one, like I said, I'm a type one diabetic. I'm
sure.
doing a lot of things, and I was like, I don't want to take one more thing. And just watching my monitor, and I was doing the numbers for Australia and New Zealand guys, and 66% of people in our country are currently overweight or obese,
Yep.
and 46% are not getting enough daily movement. And this is the figure that blows my mind. 125 people across our countries are diagnosed with type 2 diabetes every day.
Yep.
As a type 1, if I can implore anyone, if you're pre-diabetic or type 2, you can change it with movement and diet. And I would implore you for your quality of life. As a person who cannot change it, I'm
Right.
pancreatically challenged, I like to say. Like, just do yourself a favor. Like, just try this product. Like, it's really been amazing. I was talking to Jackie on Monday night after we did an education call. She's had to recommend some people take less of the assist because it's
Mhm.
bringing their blood sugar down so powerfully,
Yeah.
they're going low. So,
Yep. Yep.
if it's a product that you're not sure of, visit our website and access the TGA sharing guide, and it will tell you all the things this product is capable of. So,
Yeah.
obviously, I'm
Yeah.
biased. I love it. It's really changed some of my health outcomes. So, I'll ask some
Well,
questions.
and Jackie brings up a good point there in her comments. When I'm dealing with patients and we're talking about this, I tell them that the truth is 82% of type 2 diabetics are curable, not treatable.
Mhm.
That's a different thing. Curable. And how are they curable? They're curable with changing their lifestyle to where they're eating more fruits and vegetables, more protein, and far less carbohydrate than we eat around the world. We are consuming carbohydrates at alarming rates. And it turns out our body was made to exist on a planet without carbs. Our bodies don't need carbohydrates. our brain likes it because we all feel better when we're stressed and we reach for that carb and our brain goes, oh, dopamine hit, I feel better. But we've got to be thinking bigger picture here and make sure that what I tell patients is 2/3 of your plate should be fruits and vegetables. A piece of clean protein about the size of a deck of cards. Whatever's left, you can do in a complex carbohydrate. That's not much. That's a very sliver, right, of the plate that's left. So making sure that we're eating lots of fruits and vegetables, followed by clean proteins. And then, like in the US, we flipped the food pyramid on its head and said a little carbohydrate is okay. Let's prioritize fruits, vegetables, and proteins. So absolutely. And then move more. We've got to move more. I often tell the story when I was in Germany during my training. We had dinner and then everybody in the community went out walking. I mean, we were staying with a lady who was in her 80s, and she went out walking with us, like miles of walking that evening. And in the US, at least, we just don't do that. We eat dinner, typically largest meal of the day, and then we sit on our couches, right? The exercise that we get is in our thumb controlling a remote control for a box in our, living room. And that's not exercise. We've got to move more. So 10,000 steps a day is the goal that I set with my patients. And all of us carry things that track the steps now, whether it's a watch, whether it's a phone,
Mhm.
know how many steps you're getting, get up and move. It's important. So
So Jackie had a question. Are there any particular fruits and veggies that are better for us that you would recommend?
for sure. So your high starch fruits and vegetables are not as good for you. So think white potatoes. White potatoes, there's some nutrient in there, particularly if you keep the skins on, but the white potato is turned very quickly into a carbohydrate. Very little fiber, right? It's mostly starch. So trying to stay away from the starchy fruits and vegetables and prioritize those with fiber. The other thing that I'll say is it's important to eat the rainbow of color of fruits and vegetables for several reasons. Different nutrients come in different colors. So therefore, eating the rainbow gives you a broader spectrum of nutrients. But we're also learning that each color of fruit and vegetable actually has its own individual microbiome. So red fruits and red vegetables actually have a very similar microbiome to them, and us consuming those microbiomes gives us that great variety of microbiome in our own system that's so helpful for us. So again, staying away from the starchy ones, prioritizing the color palette of fruits and vegetables, and making sure we're getting fibrous fruits and vegetables in the system is kind of the rules of thumbs that I give for individuals.
Love. What
Yeah.
exercise would you recommend to someone with MS who can't do a big physical walk? They would love to, but it's a challenge.
Yeah, so exercise is all about finding the thing I love, right? What is the thing I love to go do? I love walking. So for me, the other day I was in São Paulo, Brazil. I went for a walk. It ended up being about 8.5 miles. It was a fantastic walk. It was great for me. Other individuals love swimming because if they've got joint problems, for instance, their knees are hurting, they need hip replacements, whatever, getting into a pool where you don't have as much weight, you've got more buoyancy, is a great way to get exercise. Riding a bike, less impact on individuals. So finding something that you love that works with the situations that you have is really what it's all about. And then also, I would recommend if there's a second thing, finding an accountability partner, somebody who will go with you, somebody that will out there. We all have the days where we're like, I just don't want to go. But if someone else is waiting for us, picking us up, someone else is waiting to talk to us while we exercise, we're always more likely to go when we have somebody that we're accountable for on that.
And if all else fails, put on your favorite song and dance around the kitchen. I do that much to my 14-year-old's horror. I'm like, dance with me. He's like, no, but I'm like,
So
exercise snacking when you're busy.
Simone, it's interesting you mentioned that. I just attended a conference a month ago at University of Arizona where I graduated, and it was an integrative medicine conference. And one of the breakout sessions that I went to, you all would have been horrified had you gone to this with me, but they had us all dancing. It was a breakout session on the health of dance, saying that
Mhm.
around the world, most native cultures dance a lot. Western culture does not. We've kind of eliminated that as a form of exercise, as a form of expression, and that we could do that a whole lot more for the health of our patients or the health of ourselves in this case. And so dance is a great way to do that. I love that suggestion.
It's fun. It's a great way to connect. And teenagers don't really want to use words. So I find that's really fun.
Yeah, yeah.
Poor child's going to need a lot of therapy, but he'll be okay.
There
There
you
was a
go.
question higher up. What about Shinrin-yoku versus Northern Escape? Well, I think we know how you feel about Shinrin-yoku, but
I
I'm asking the
know.
question.
If it were me, so here's the difference between the two. Okay, so Shinrin-yoku was formulated by a perfumist to smell like the forest. So that's why you see all those conifer trees in there, right? Which is an amazing blend, and it does smell like the forest. What we did with Shinrin-yoku is say, well, let's lead with chemistry in Shinrin-yoku. What is the chemistry that the forest is breathing out? Not what is the chemistry of the trees, that's Northern Escape. What is the chemistry in the air of the forest? And so when you look at the chemistry of the air of the forest, it has things in it like linalool and limonene, citrus, right? Lavender. You wouldn't think that, but that's in the air of the forest. And so that's the difference in Shinrin-yoku is we led with the chemistry for that blend to make sure that we were getting all of the respiratory benefits of breathing in forest air. So given the choice, I would prioritize Shinrin-yoku, but I still love Northern Escape because it brings me back to the mountains.
And
So,
you can use them together to get both of those
sure,
benefits, right?
for sure. Yeah,
Like
absolutely.
I combine everything. The poor team downstairs, I'm always chasing them for telling them put their diffusers on. And I'll give you a diffuser blend I love, guys. It's equal drops of Spanish sage, peppermint, or supermint, and balance. It's just like a fragrance
Wow.
extravaganza. Like it's a I'm like, you're all giving me bad vibes. So Spanish sage goes on, right? Because I can't spray them and I can't burn Spanish sage in the office. But it's just, but every time I do it, people comment and then they start using the oils. I think we forget we've got such a broad spectrum of products. We forget how amazing they are. Even those of us that work here, right? We just go to our favorites. Like normally I go to Shinrin-yoku, but I'm like, no, we're going to try some different things. I have another question for you. Would
Yeah,
Copaiba soft gels be safe or Copaiba? I always want to do
there
that
you
when I
go.
say
I know.
Copaiba.
I know. You sound
Be
Brazilian.
safe to take for someone who is having dialysis 3 times a week.
Yes, I mean I mean if there is a nice thing about being on dialysis is you're always monitored by a physician. So, and I'm a fan of start low, go slow. So I would start with one Copaiba a day, a soft gel, and then as your doctor is monitoring your kidney function, then you can know, all right, did it affect my kidney function or did it not? The other thing about dialysis is the purpose of dialysis is to remove chemistry from the bloodstream. It's the job of a kidney, right? So as long as you're not overwhelming the system, then you should be able to do that, right? And so I don't have any concerns about it as long as you're doing this in partnership with your doctor, that they're aware of it and they're aware to monitor that function of the kidneys, which again, they're doing anyway with someone that's on dialysis.
Awesome. I think that's all of our questions that we have in the chat. Oh, another one's just popped up. Would Copaiba soft gels be okay for someone going through chemo?
I wouldn't have an issue with that either. I wouldn't be
Mhm.
too concerned
Same
about that.
reason?
Yeah,
Yeah.
there should be no interaction with Copaiba and the chemotherapy. And again, often with those that are undergoing treatment for that challenging time in their life, they need some relief from that. And so Copaiba could be a great balancer for them to help their system feel better. So,
Awesome. One last
yeah.
question.
Yeah,
I have a customer with a 5-year-old with lots of UTIs and has been on antibiotics since Christmas. That's a long time, guys.
a long
Would
time.
Copaiba soft gels be okay for her?
A 5-year-old, yes. The only concern is swallowing, right? It could be a choking hazard. I would probably consider instead of that. I personally don't mind the taste of copaiba. To me,
Mhm.
it tastes like smoky wood. And so I would say probably rather than using the soft gels, I'd put a drop of copaiba in their mouth or under a tongue or in a smoothie if they don't like the taste, etc., and get it inside that way rather than risking choking on a soft gel. 5-year-olds just tend not to swallow those really well. You get to be 7 or 8-year-olds, they do better. But yeah, Jackie, good suggestion. Grated
Yeah.
juice, right? Other ways to get it in the system, and then you can
And
do it.
gummies. Yep.
Yeah.
Great. Well, that is all of our
Okay.
questions. I'm
Okay.
speaking on behalf of everyone. We're very grateful for your time and
Of
expertise and for answering
course.
all of our questions. We always love to see your smiling face and learn from you. And I
Thank
know,
you.
you've been working very long days and hours. So thank you
Oh,
for all of your time and care for our market. We really appreciate you. There's a few questions there around accessing the recording. If you've registered for the call, which you guys have, I will be sending that out. But yes,
yes,
thank you,
yes.
Dr. Riggs.
Thank you guys. I so appreciate the invite. I always love being with you. Here's the deal. I love what I'm able to do, which is partner with you guys in helping the world. We together create this incredible army for good, trying to help people with challenges in their lives. And we create this incredible army together. And I love the pattern of doTERRA that allows us to share knowledge with each other and then go find those that need that knowledge and improve their lives. That's what this is all about,
Mhm.
improving people's lives, and grateful to be partnered with all of you in that. So thanks for
Thank
the
you so
invite.
much. We appreciate it greatly.
You bet.
Thank you, everyone, for joining us on your lunchtime, and I will see you all on the next call. Bye.
Bye bye.